I'm going to show you why you should think twice before letting anyone put filler in your tear trough or under eyes. Unsightly skin color changes. Stubborn puffiness called Malar edema that gets worse when you drink a margarita. Inadvertent injections into the eye socket creating huge puffy eye bags. And most commonly, a sneaky little blue-gray puff right where the skin of the face is the thinnest and you can see the filler product.
So this is a surgeon in America who's describing that tear troughs shouldn't be done because there's lots of complications associated with them. So actually, a few of the complications they've mentioned, like the Tyndall effect, which is the bluish-greyish colour that can happen from water retention, the malar edema, and all of those other complications they mentioned are applicable in some cases. However, it all depends on the injection technique and the placement of the product. If you place a product within the malar edema, which is what we call festoon, then it can make that worse. So obviously, it's better to avoid that area or to use a slightly more elastic or a specialist fill like Juvéderm volume underneath the malar edema to blend it out, which is what we do, or injecting the tear trough above that area so you don't make the edema worse. Placing too much product can make the area water retained, so it looks puffy or edematous and can give that bluish greyish colour, which again is unlikely if it's done properly. It doesn't mean you shouldn't do it just because there are complications, rather you should do it properly.
Lymphatics in that are so vulnerable to damage, and sometimes this puffiness is irreversible.
So the lymphatics in this area are very delicate, that's absolutely correct, and that's why the placement of filler needs to be very kind of conservative and very, should we say, accurate and well mapped according to where the indentations are. However, he says that the puffiness can be irreversible. That's just simply not true. Dermal fillers are reversible by design, and even if they cause water retention, it can always be dissolved, so it's never ever a permanent issue.